Welcome back. A Madison nurse is making a difference halfway across the world.
Susan Gold has been a nurse at UW Hospital for nearly 30 years now, and for nearly half of that time, she's taken her skills to Africa working with HIV-positive kids, and now her work is being recognized with a first-ever national fellowship. Only our Leah Linscheid has her story.
Right.
Nursing is something of a calling for Susan Gold.
It's something I was always interested in.
Maybe because of her unique ability to connect with people. But she's always wanted to try something different, halfway across the world.
But I graduated from the UW nursing school at the age of 40 with a husband, 3 kids, and a mortgage, and couldn't really say, see ya, I'm gonna join the Peace Corps. And this is Rosalia.
The first time Susan traveled to Africa.
She is an amazing young girl who was so bright.
She worked at an orphanage with kids who were diagnosed with HIV/AIDS.
And that was where I realized how little the kids actually knew about HIV and AIDS and about reproductive health.
Upon her return to the States, Susan created a first-of-its-kind reproductive health class for kids in Africa called Talking Health Out Loud.
You know, who would have thought that I would become the sex nurse of East Africa? I mean, my kids think it's the funniest thing ever.
Since then, she's been back to the country 11 times, teaching her curriculum to dozens of children.
I believe that adolescents all over the world deserve to know the truth about their bodies. And when kids have accurate information, they can make informed decisions based on their own cultures and beliefs that will help them live a long, healthy, normal life. And that's what we all want for the world's adolescents.
Now, Susan is preparing for yet another trip to Africa, this time under the first ever awarded Nelson Mandela Fellowship. The national grant will allow Susan to work with physicians in the country to implement her sex education curriculum for 50 HIV-positive children.
It's not just us going over to help them. It's us working together, that we both bring things to the table.
Susan's work has helped her make connections between her work here in the U.S. and her class halfway across the world. Because, as she's found, there isn't much of a difference.
Doesn't matter if you live in a slum in Dar es Salaam or Nairobi, or you live in Madison, Wisconsin. We all want the same thing.
Leah Linscheid reporting. Susan will leave for Africa on Saturday and return the following weekend. She's no stranger to receiving these first-ever grants.
Back in 2007, Susan was the first ever nurse to receive the Fulbright grant, which she used to help launch her education curriculum. Congratulations.